Hodin. And I'm an attorney and project director at Community Catalyst. I want to thank you for holding this hearing to allow for the community to voice its questions, its comments, and its concerns about the proposed conversion of Caritas Christi to for-profit status. This transaction would result in a major change in the healthcare landscape of Massachusetts and requires a hard look at the potential impact on the communities served by the hospitals. I'm pleased to offer my oral comments today and will also submit a set of written comments. Let me tell you a little bit about Community Catalyst first. We're a national nonprofit advocacy organization dedicated to quality, affordable healthcare for all. Since 1997, we've been working to build the consumer and community leadership required to transform the American health system. We work in partnership with national, state, and local consumer organizations, policymakers, and foundations, providing leadership and support to change the healthcare system so it serves everyone, especially vulnerable members of society. From 1996 to 2004, Community Catalyst, with the West Coast Office of Consumers Union, the publisher of Consumer Reports, led a joint project called the Community Health Assets Project, or CHAP. This project provided expertise and assistance on the conversion of nonprofit healthcare institutions, hospitals, health plans, Blue Cross Blue Shield plans throughout the country, and offered technical and strategic consultation in the creation of healthcare conversion foundations. Through CHAP, we worked with a variety of regulators and analyzed numerous state statutes related to conversions. It's our experience that the regulators who were diligent in their review of the transaction were most successful in protecting the assets of the community and were champions for consumers in their states. As a result of the project, we helped to heighten regulatory scrutiny of conversion applications and other proposed transactions, preserve more than $18 billion, that's billion with a B, in charitable assets in more than 170 new health foundations, expand the capacity of dozens of local groups around the country to successfully represent their community's interest in health system restructuring, and educate advocates, regulators, the media, and the public through publications of a Conversion Model Act, a compendium of conversion laws, a guide to building strong and maintaining strong foundations. Concretely, as a result of this work, 3 Blue Cross Blue Shield conversion proposals involving plans in multiple states were rejected as running counter to the public interest, and 2 were withdrawn by the plans when regulators began asking the hard questions. In the hospital sector, the project helped to ensure that any approved deal included conditions that protected access to healthcare services and preserved charitable assets. In the mid-1990s, when we began this project, the health system was undergoing significant change. The rapid growth of managed care and the drive to lower costs transformed the health care marketplace. Suddenly, nonprofit corporations claimed to need significantly greater access to capital, and we saw a tidal wave of hospital conversions. With national health reform beginning to be implemented now, it appears we're now at the doorstep of another period of healthcare transformation. And as a result, I think we're going to begin seeing a new wave of hospital conversions, mergers, and sales. And although it's now 2010, the questions remain the same. As many others have raised, the first question is, what impact will the conversion have on the quality, accessibility, and affordability of healthcare? Related questions include, which healthcare services will the new for-profit prioritize? Which will they continue or expand? Which will be reduced or eliminated? And what will happen if the for-profit decides to sell, merge, or transfer to new owners? In order to answer these questions, we think it's essential that the Department of Public Health hire an independent consultant to conduct what we call a community needs assessment. Second, and I wanted to acknowledge the impassioned descriptions of Kearney Hospital and what it means for the community. As Mayor Menino said earlier, this is a neighborhood institution. It's a neighborhood asset. And so the second question is, what will happen to the nonprofit assets that have grown over the years as a result of donations, tax exemptions, and all of that community support that we've heard about today? As we heard earlier from the Attorney General's office, under charitable trust law, if the nonprofit converts to a for-profit, all the assets of the nonprofit must continue to serve its charitable mission. Typically, this has resulted in the creation of a foundation into which the charitable assets are deposited. In this case, the parties to the sale assert that there are no remaining assets to create such a foundation. While this may ultimately be the case, the nature of the assets, because they essentially do belong to the community, The nature of those assets demands a high level of scrutiny, and we believe it's essential for the Attorney General's office to commission an independent evaluation of the Caritas assets to ensure the fair market value is being paid. A well-known example of why an independent valuation is necessary is found in the 1994 conversion of Blue Cross of California. There, with the assistance of an outside financial consultant, the $100 million, that's with an M, that Blue Cross originally identified as a charitable contribution was valued at the end by the independent consultant at more than $3 billion, and again, that's with a B. The sale ultimately resulted in the creation of two foundations, the California Endowment and the California Wellness Foundation, which have gone on to support healthcare advocacy and programs throughout California. It's also important to take note of the conditions that other regulators have imposed in order to protect the public interest. For example, in the conversion of Sharon Hospital, Connecticut Attorney General Richard Blumenthal required the for-profit buyer to share with the conversion foundation 25% of net earnings in excess of 7% of total revenues for the first 10 years. In the conversion of Daniel Freeman Hospitals in California, California regulators imposed conditions such as an extended period the tenant was required to keep one of the hospitals open, the delivery of more free care to the community, and a reporting mechanism for the AG to monitor the amount of free care provided. In the sale of Bayonne Medical Center, the New Jersey Department of Health and Senior Services required that the new owners create a community advisory board, and that they, excuse me, and that the new owners create a community advisory board and they conduct a community needs assessment within 6 months of the closing. These are just a few examples, and we're happy to supply more in our written comments. So to conclude, this deal is being watched carefully, both here in Massachusetts and elsewhere. I can assure you, from prior conversations, that regulators in other states are looking to see how the deal here is reviewed, and ultimately what is done to protect the healthcare services and charitable assets. The stakes are high, and thus we urge you to scrutinize this deal carefully by hiring an expert to conduct an independent evaluation, hiring an expert to conduct a community needs assessment, and if the deal is deemed to be in the public interest, create a foundation to account for the community's long investment in this system. Thank you.
Thank you very much.